I think that having empathy and vulnerability as a leader are two very undervalued skills or traits. I've worked really hard to be a vulnerable leader, but in the field I'm in, it's pretty easy to do, to talk about mental health because that's the business that we're in. But when I talk to other leaders, reminding them that by being vulnerable about what's going on in their personal lives, they're creating a safe space for other employees that they have to also talk about what's going on with them. And I don't think that happens enough in the for-profit world. I wish it happened more. And when I've talked to other CEOs and other leaders and other organizations that are in the human service field, it still feels like an anomaly to them that they would talk about their own mental health stuff with their leadership team. But I really believe that leading from a place of vulnerability is what creates that safe place that allows for it to be a regular conversation. And then when your employees are sharing what's going on with them, it gives you an opportunity to talk with them about what they need from you as an employer and ways that you can support them. I think there are times where if leaders share stuff about their personal life that maybe they're viewed as being soft or not always in control. And I just think it's an inaccurate statement that if you share stuff about your personal life, that you're blurring this line of boundaries. I think you can still have high emotional integrity and still share things about yourself and be willing to listen when someone wants to share something about them and still be a strong leader that's in control of what's going on in their organization. When we look at the mental health fallout of the pandemic, we are not talking about, days or weeks, but we're talking about months and years down the road. And I think it's a very true statement that we will see the fallout for a long time. And I think we need to be mindful of that as employers. And I think we need to be mindful of that as humans, that everyone's experience with the pandemic was different and that we aren't all going to be back to a baseline, back to a normal at the same time. And so I worry that suicide rates will increase in the coming years. I know that we'll need more therapy and more interventions that are trauma-informed to really be able to meet the needs that the pandemic created. And I encourage all leaders in all organizations. And a leader is not just the top paid person in an organization. I think leadership shows up in all sorts of ways, but creating safe places for people to have honest conversations about what's going on in their personal lives and what it is they need from their employer to have a good work quality of life is incredibly important. So just having those conversations, creating safe spaces, and then making accommodations for your employees that really fit their needs so they can be their very best on behalf of the organization that you lead. Foundation 2 continues to work hard to be a place that meets people where they're at. And sometimes that's at your place of work. And so knowing that our mobile crisis teams can show up at an employer and provide an intervention and provide some de-escalation, some stabilization, suicide screening and assessment, and really just be a resource to employers as they're also learning to navigate this new area of managing and supporting their employees as they work through mental health challenges. I think our crisis line is a great first place of entry. It's a first place to start. If your employees don't know where to go for support, calling our Foundation 2 crisis line is the best place to say, here's what's going on with me, and figure out a plan moving forward and talk through what your strengths are and what you need and really provide some support. And those services are free, they're confidential, they're available 24 hours a day, 7 days a week, 365 days a year. And our counselors are waiting for people like you to call them and to provide you support.